Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for a long time and I love it. Today I'm here to teach you Norma Occipitalis. Let me turn this skull around, okay? So this is what we're going to learn, the Norma Occipitalis. The occipital bone and the other bones, the skull as seen from posteriorly, okay? So let's begin this class with a question. Ma'am, why should we study the normas? Don't we have enough to do? I agree with you, but the answer is very simple. The student who knows bones of the skull knows the head, face, neck region. There is no option for studying the skull. You have to know your skull, okay? So my advice is study your skull. Study your normas, study your mandible, study the humble hyoid. Everything, every bone that you get in head neck region, study it well. Okay? If you want to know your head neck well. So if I have convinced you, I'm going to now show you some commonly asked questions. See if you know the answers to that. Enumerate bones forming Norma Occipitalis. What is lambdoid suture? Name structures attached to the highest nuchal line. What is external occipital protuberance and so on. See, you probably have a general idea for all these questions, but to be able to precisely give the correct answer in the viva, you need to actually know them well. Build your knowledge base. So let's do that. Let's build a knowledge base for you. Okay? Right. So what is Norma Occipitalis? Let's ask ourselves that. It is the skull as viewed from behind. Okay? So whatever you're seeing now is your Norma Occipitalis. What are the bones forming Norma Occipitalis? These two above, parietal bones. Okay? Here, the squamous part of the occipital bone. And at the two corners here, okay, the mastoid part of temporal bone. Right? So these are the bones that are forming the Norma Occipitalis. Above, two parietal, here occipital, and here the mastoid part of temporal bone. Right. So if you're done with understanding bones, bones are always joined together by what in the skull? Joints. What do we call these joints? We call them sutures, right? So which sutures? Lambdoid suture here. So that's between the parietal bone and the occipital bone. This is the lambdoid suture, okay? Posterior part of the sagittal suture. Remember, this is this one that went up in Norma verticalis. So the same thing comes down here and is the posterior part of sagittal suture. Then parieto-mastoid. Look at the image here. It will be difficult for you to see on the skull. See this one between the parietal bone and the mastoid bone, parieto-mastoid. Between the occipital and the mastoid, occipito-mastoid. So all these are the sutures that are formed in the skull in Norma Occipitalis. Okay. Question is, can you classify lambdoid suture? Can you classify the sagittal suture? Yes. Okay. Lambdoid suture is a denticulate suture, where the edges of the bones that are articulating are tooth-like and they fit into each other. What about sagittal suture? The sagittal suture is a serrate suture. The edges of the joint of the bones that are joining each other are like the edge of a saw. Right. So we're done with the bones forming, we're done with the sutures. Let's talk about some features of this. Okay. In this bone, I can see here, observe it there and then come on to the skull, a point which is called as the lambda. Can you see the typical lambda letter? Okay. So this point is called as the lambda. Similarly, asterion. Asterion is a point where the parietal bone, occipital bone and the mastoid bone meet. Here is your asterion. Okay. The parietal bone, mastoid and the occipital bones are meeting here. Okay. So I seem to have written some additional letters here. Posterior fontanelle, posterolateral fontanelle. What is all this? Let's take a look. So here you're seeing the developing fetus. This is a fetal skull. Okay. So you're seeing that part of the skull is bony while part of it is membranous. It is still not ossified, right? So this small membranous bit that is not ossified posteriorly between the parietal bones and the occipital bones is called as the posterior fontanelle. Okay, this will ossify around the age of 3 months. Here now is the posterolateral fontanelle. Similarly, it's a membranous part of the bone which is not yet ossified between the parietal bone, occipital bone and the mastoid bone. This is posterolateral fontanelle. When it ossifies, it forms the asterion, and when the posterior fontanelle ossifies, it forms the point called lambda. Okay, right. Let's now talk about some foramina. Where do you get foramina in Norma Occipitalis? Let's take a look. Can you see 2 foramina there? You can see them here as well. These 2 are called as the parietal foramen, obviously because they are in the parietal bone. What function do they perform? I want to show you the mastoid foramina as well. Okay, so here in this skull, it's not that well visualized. These 2 are the mastoid foramina. You can see them there to have a better idea of the mastoid foramen. The question is, why exactly are these foramina there? What purpose are they serving? Take a look. What is this image, students? Yes, it's a section through the scalp and a little bit it has gone inside as well. Can you see that there is an emissary vein here which is joining the structures in the scalp with the intracranial venous sinus passing through the parietal foramen. Okay, so what it is doing is it's passing through that parietal foramen to communicate the scalp with the internal venous sinus. Okay. Also, you may find a branch of occipital artery passing through the parietal foramen. If that is the case, what is passing through mastoid foramen? Through the mastoid foramen again, it's the emissary vein which passes through, okay, communicating the posterior auricular vein with the sigmoid venous sinus on the inside. And of course, there may also be a branch of occipital artery passing through. So, we saw 4 foramina, 2 parietal foramina, 2 mastoid foramina. Parietal foramina and mastoid foramina basically communicated the structures superficially with those which are lying inside the venous sinuses, intracranial venous sinus. In case of parietal foramen, it is superior sagittal sinus. In case of mastoid foramen, it is the sigmoid sinus. Okay. So that's why these foramina are there, and in both the cases, branches of an artery may also pass inwards through these foramina. Right. So let's continue our discussion of features now. Let's talk about what is the most prominent part posteriorly called the external occipital protuberance. The tip of that is called as the inion and gives attachment to muscles trapezius and upper end of ligamentum nuchae. It gives attachment to the muscle trapezius and upper end of ligamentum nuchae. Where is the rest of the ligamentum nuchae attached? It's attached to the external occipital crest, which is a midline elevation that can be found here, extending from external occipital protuberance to the foramen magnum. It's a linear elevation. Okay, so that's the external occipital crest. So what did we learn now? External occipital protuberance, inion giving attachment to trapezius and the ligamentum nuchae. And below that, a longitudinal crest called external occipital crest giving attachment to the rest of ligamentum nuchae. Let's talk about something called nuchal lines. There are 3 nuchal lines, students. Highest nuchal line, superior nuchal line, inferior nuchal line. Use your hands. Highest nuchal line, superior nuchal line, inferior nuchal line. One below the other. Let's take a look. Here you are seeing the highest nuchal line. Here you are seeing the superior nuchal line. Here you are seeing the inferior nuchal line. And inferior nuchal line lies between the superior nuchal line and the foramen magnum, exactly in the middle. So why are these lines created? Remember, any elevation or depression on the skull is related to the structures which are attached to it or passing close to it. These elevations, depressions don't just happen automatically. There is a reason for them. Okay, so let's now talk about what is attached there. Okay, so let's talk about first the highest nuchal line, which gives attachment to the gallia aponeurotica. What is gallia aponeurotica? Gallia aponeurotica is the aponeurosis found in the scalp. Okay, lateral part of this highest nuchal line gives attachment to a muscle, occipitofrontalis. Okay, come now below to the superior nuchal line. This gives attachment to trapezius medially and sternocleidomastoid and splenius capitis laterally. Now below this superior nuchal line, you are seeing a couple of depressions. One depression medially, one depression laterally. The medial depression here gives attachment to the semispinalis capitis, and the lateral depression gives attachment to the obliquus capitis superior. What are the two muscles? Semispinalis capitis, obliquus capitis superior. Now cross the inferior nuchal line and come to the space below the inferior nuchal line. Here you will find the attachment of rectus capitis posterior minor and rectus capitis posterior major. Okay, so these are all the attachments on the occipital bone, okay, which is part of the Norma Occipitalis. Can we revise as one, students? Okay, highest nuchal line gives attachment to the gallia aponeurotica and occipitofrontalis muscle. Superior nuchal line gives attachment medially to trapezius, laterally to the sternocleidomastoid and splenius capitis muscle. Now, between the superior and inferior nuchal line, there are two depressions. The medial one gives attachment to the semispinalis capitis and the lateral one to the obliquus capitis superior. Below the inferior nuchal line, there are two depressions. One is for rectus capitis posterior minor and rectus capitis posterior major. That completes the muscle attachments. Okay, so let's go back to the same set of questions we started with. Enumerate bones forming Norma Occipitalis. Now it's easy. 2 parietal, 1 occipital and 2 mastoid. What is lambdoid suture? The inverted Y-shaped suture that you saw. Name structures attached to highest nuchal line. We just revised it. Gallia aponeurotica, occipitofrontalis muscle. What is external occipital protuberance, students? The most protuberating part of your skull at the back is external occipital protuberance, and the tip of it is called inion. What is attached between superior and inferior nuchal line? What is the artery passing through mastoid foramen? What is posterior fontanelle? What age does it ossify? And so on. Finally, a question I want you to explore on your own. What is interparietal bone? Please put the answers in the comment section. I would love to know what you have understood about this. So, that, my dear students, completes Norma Occipitalis. Remember, set your goals high and don't stop till you achieve them. This was just a tiny little goal. There will be many more coming. Okay. All right, students, it was a pleasure taking this very short class with you. I hope you understood. Thank you very much.